Buddy, thanks for being here. We appreciate you coming here. Today we are doing a pop-up clinic downstairs, and I want to thank Reverend Draper for his hospitality in helping us do this. I also, obviously, with me today we have Mayor Walsh here, Deputy Mayor Owens is here. We have the world-famous Dr. Gupta is here. Where's Dr. Gupta? I see two, so I can't, Doctor. Don't go to my left side. That's my bad side right now. But we have a lot of community members, incredible messengers here. Ann Rooney from my office and our team who really have just worked 24 hours a day for the last year in this pandemic. But really today, the fact is that we've been into vaccinating, and now we're at a point where supply is getting better, and that's the good news in the community. And so now really we start to assess where we are, and we start to really dive into the data and where we need to be specific to all neighborhoods in the county, specific to every person in the county. And we're starting to see some trends. So it's one of the things that we are seeing is that in specific minority communities, and today specifically we want to highlight in the African American community, we need to get better participation. And we understand that folks are hesitant, and we understand there's really good reasons why folks are hesitant, and we understand the history of what's happened in this country. But today we have credible messengers here, and folks who are going to share their story about and their experiences about COVID, and why the quickest way for us to get our lives back and the quickest way for us to be able to recover and rebuild and re-engage to handle other important issues in our community is we have to vaccinate. And so one of the data points I wanted to share is through our pod. So when I say our pod, our point of distribution, it's either the On Center, it's all of our pop-up clinics as well. We capture data, and we get macro level data from the county, but it's not as specific as this from the state through the fairgrounds. But essentially, to give everybody an idea, our pod, and again, our pod's better than the countywide data because we're doing things intentionally. But our pod, 83% of those vaccinated to date have been Caucasian. 80% of our community is Caucasian, so higher percentage there. 6.7% African American. It's been in this range since we've been tracking. To give everybody an idea, about 10.6 to 11% of the community is African American. So we need to do better. 1.9% essentially right now, what we determine as other, your Latino and Hispanic communities will fall into that. That number should really look like 4%. And then 2% Asian American in our community, 1.8% of our pod has been Asian American. So that's the closest out of our minority communities there. So the work, just before we start hearing from some speakers and hearing from the mayor, I really want to thank Rashida Caldwell and Tamika Barnett with us today. They have done really, really great work registering hundreds of people in the community. Tamika is a Board of Education member. She's also a Syracuse firefighter. And Rashida actually serves us with the Allen Foundation right now. She's also a candidate for Common Council. She'll do a great job there as well. I want to thank Monica Williams from my team, who's my Commissioner Office of Diversity and Inclusion, for the work you've done, Monica. I think you just got a shot too, right? All right. That's what we do. And so, and again, Vernon Williams, Legislator Williams isn't here today, but Vernon was really advocating to get us over here, Rev. And so we're happy, Vernon did that. And we're going to need everybody's help moving forward. I want to thank, obviously, those who helped us with pop-up clinics previously, Pastor Darren Jaime, Jalen Clifford from the Syracuse Housing Authority, and Bill Simmons, the Northeast Community Center, Dr. Weeks School, and then both at the Shawner Street Boys and Girls Club and the East Fayette Street Boys and Girls Club. It takes a community now at this point. When we have supply, we got to get to our hard-to-reach communities, whether it's going to independent living facilities for our senior populations, but getting into the neighborhood. And so at this point, I'm going to turn it over to the mayor who's been a great partner throughout this pandemic. So Mayor Walsh, why don't you come on up?
Thanks, County Executive. I'll be brief. I want to thank Pastor Draper for hosting us here at Tucker. These pop-up vaccination clinics have been critical to even getting the numbers where they are. And again, we're here to say that they're not where they need to be. We know in the city of Syracuse we have a high proportion of our population that is considered hard to reach. That includes African American community, Latino community, other minority communities, and we need to be very intentional and strategic in how we get people to the vaccine. I want to acknowledge the county executive's partnership and efforts here. I've been clear from the beginning that the pandemic response, COVID response in this community starts with Onondaga County, the county health department. County executive, his team, and Rooney, Dr. Gupta have done an incredible job for our community. And this guy specifically, we've all been worried about him and his health recently. He's been carrying us on his back, and he's still okay joking about it. But it's obviously taken a toll on him. It's taken a toll on our community. But I want to thank you, Ryan, for everything you've done for our community. I think what keeps him going, what keeps me going, keeps all of us going, is that we're starting to see light at the end of the tunnel. And as I've said from the beginning, again, our job at the city is to play whatever role, fill whatever gap exists in our COVID response. And there is no more important role for the city of Syracuse to play right now than to connect our constituents, our residents, with the vaccine. So that's what we're doing with the pop-up clinic today. That's what we're doing with this event to bring awareness to the community. We need to go where people are. That's what we're doing. We're going to do a lot more of it. But beyond myself, beyond the county executive, the other individuals in this room, they are leaders in their own right. In some ways, they are more important, and what they say is more important than anything that I say as an elected official. These are our credible messengers that are leaders in their communities and their neighborhoods, and when they speak, people listen. And they're going to speak today about some personal experiences they've had and how we need to come together as a community and continue to support each other. So with that, I'll turn it back over to the county executive, and again, thank you.
Thanks, Mayor. First, we're going to hear from, because this is his real estate. So Pastor Draper, we're going to hear from Pastor Draper about his experiences. Then we're going to hear from the deputy mayor. And then with us today, Syracuse men's assistant coach, Alan Griffin, as well, is here today. And they're going to all share some of their experiences with this pandemic. So Pastor, come on up.
Thank you to our county exec, and certainly to our mayor, and certainly to our deputy mayor and all of the teams of the county and the city that is represented here. First of all, let us say thank you for allowing us to be a part of this partnership as we try to curtail and curb this pandemic here in our community. Especially hits home for me as I was in the hospital with COVID, trying to serve our community. I, as a pastor, our church has been affected based upon the fact of members who have lost loved ones and then members who we've lost to COVID. But it hits a little differently when you as the leader are affected by it. And so it left my congregation without a pastor for a few days, still fighting it. So I stand as a representative that we are in support of the vaccine, not just for our community, but for every community. Because COVID is not a racist disease. It knows no color, and it knows no geographical location it will not go into. And so we are here, and we're just grateful that we're able to partner again with the county and the city today, and to have people in every community, but especially the African American community. And I know a lot of us have heritage and roots in southern states, so some of us suffer from historical hindrances, and we fear that the same thing will happen that happened years ago. And often people ask me, they say, well, Pastor, and this is just me, I'm a pastor, so I only know one way to be. They say to me, they say, well, Pastor, the vaccine came so quick. I said, well, when you're dealing in our business, sometimes the Lord works that way. When you read the Bible, the woman with the issue of blood, the Bible says, and immediately her blood dried up. It said he laid his hands on her, and immediately he received his height. So I stand on the fact that we have a responsibility to the total community, but those of us that lead and labor and love in urban populated communities, such as where Tucker is and other local churches, we are asking you, we are lonely on Sundays preaching to cameras. We need you to get the vaccine so we can come back in the building together. Because it affects the morale, it affects our children, and so we just need us all to play a part. I say this to other pastors, that right now it's like the Chicago Bulls, and County Exec McMahon is like the general manager. And we've made Mayor Walsh, Michael Jordan briefly. But the rest of us have our responsibility that when it's our time to take the shot, that we be a participant. And so we stand with, and we know everybody has their own religious and own view of it, but our whole thing is, and I said this to them, that I had some people say to me today, well, Pastor, what about the side effects of the shot? I said, well, here's the flip side of it. You can take it and have side effects, or not take it and go to the cemetery. You make your mind up which one you want to do, because it's that serious. And for those of us that have had to live with it and live with the lingering effects of it, we know how serious it is. It's still sometimes tough for me to get my breath together and walk upstairs, and so it's serious, and we want what's best for our community. And we want to listen to science. We want to listen to our leaders, and we are urging you that will to be open to at least hearing what people are saying about the vaccine, and let's be a team player, and let's take our community back by participating and getting this vaccine. Thank you.
Thank you, Pastor. Here, I've been on to share my personal testimony and that of my family. Our entire house, as 4 of us, were infected with COVID. And I watched that disease affect us very differently, with myself ending up in the hospital as well, needing aid. And I'm glad that I was and you were able to come out of that hospital, but there are so many people who are not coming out of those hospital beds, and too many of them that we've lost to this disease. Let me speak to whoever is listening or whoever wants to listen to me. COVID is not the flu. It is not. I've had the flu. And what I suffered through and what my family suffered through was not the flu. My mom is in her mid-70s, and just like so many of you, I miss her. You know, I talked to her on the phone, and we've been able to speak 6 feet from each other. But I want to hug my mother again. And so when she came to me and she said, you know, Sharon, I'm able to get the vaccine, I said, talk to your doctor, but your daughter is saying yes. And I'm going to. When it's my turn, I'm standing right in line, because I want to protect my family, and I want to hug my mother again. We're tired, but this is not the time to let up. I will repeat, this is not the flu. This is not, I struggled. My family struggled. I see my husband as the Superman in our family, and to watch him be debilitated by this disease and this virus. So please, the man of God told you whether you wanted to hear the word of God or not. He gave you both sides of it. And I'm saying to you, when it's my turn, I'm stepping right up, because I want to protect me, and I want to protect everyone around me, my friends and family and loved one. And I'm ready to hug my mama.
I don't know how to follow this up. First and foremost, I want to thank the county exec and the mayor and their teams for, you know, allowing me to get up here and, you know, sharing my story with COVID. When COVID first hit America, and we were trying to win a basketball game or two, I got a call from family members back at home that my uncle was missing. And next thing you know, 2 days later, he had passed. And now my uncle was probably in his mid-40s, probably late 40s, mid to late 40s, excuse me, and in decent health, not great, and he died to COVID. And now I'm sitting up here saying, what is COVID, you know? And now, you know, a year later, and seeing what COVID is, and now having a vaccine available, it made it very important for me to step up and get this vaccine because, again, I have children. I'm around other people's children every day, and I have to be the responsible one to, you know, get this thing going, especially for my community, which a lot of our players are from the African American community. So it hit home, you know, very hard because, again, my uncle was probably the backbone of my family, and seeing him go this way was a tragedy because we weren't able to say our goodbyes because of COVID. And now, hearing that there's a vaccine out there that can, you know, get us back to normalcy as fast as possible, why not? Why not do it? You know, and at first I was very hesitant of getting the vaccine just because of the stuff that I would hear other people say, but not listen to the doctors. You know, I'd listen to the, you know, quote unquote street doctors out there, you know, and when I started to kind of do my research and understand, you know, my responsibility in this whole deal, I said, you know what, it's my responsibility to doing it. And I would say this in front of everybody that I had COVID myself. I had minor symptoms, if none. I got my COVID vaccine last Friday, and I had nothing to go wrong with me. I'm here talking to you as healthy as possible. And I want to see my kids, and I want my kids to grow up in a safe environment. And if you want your family members to do so, we all need to get the vaccine. Thanks.
Dr. Gupta, they covered it all? They did pretty good, right? Yeah. All right. Questions for anybody? Yes, sir.
Thank you, Coach, for taking the time. Have you ever thought about getting maybe Coach Boeheim or Athletic Director John Walsh to also advocate for the vaccine to further the message, knowing that so many people look up to them in their position?
Yeah, definitely. You know, the one thing about Coach...
You want to come over? Come on up here.
Sorry. I know I'm taking over mayor and county exec. Don't worry about it, okay? Don't worry. You know, I think our athletic department as a whole has done a phenomenal job at trying to make sure that, you know, our student athletes, you know, social distancing, take proper caution to, you know, wearing the mask at all times and just going through the COVID protocols. But they've been very, you know, good with, you know, making sure that we all are safe and the community is safe first and foremost. And I think, you know, these guys will definitely do it, Coach Boeheim and John Walsh, if asked so. Any more questions?
Pastor, are you getting the message across? I guess that's the question. You're here talking, so obviously are people listening? And what more needs to be done?
From our standpoint, this is the second church pop-up that I know of. My friend and brother, Pastor Jaime, was the initial pop-up that got us. The difference is we're reaching more people virtually, but honestly, we haven't been preaching vaccine. We've been preaching because it's a transition, and so now because, you know, initially when the vaccine was made available, there was a shortage, so there was really no way we can say, because you can get people excited about something and then they will not want to do it out of disappointment. You say my name's going to be on the list, then they waiting on a call, they never get a call, so now they don't want to deal with it at all. And so for us, from this point on, I'm sure other pastors across the country that I know and major cities have been doing it, and I'm sure we will as well. Like I said, I was out of my pulpit for a while, so just coming back into it, I will make sure every Sunday that we say something about our people receiving the vaccine. Not just, when I say our people, I don't mean that as African American, because I have people that watch me as far as other countries and other states, and so we want to make sure everybody is getting the vaccine so we can reach the herd immunity level. I think that's the word. I'll be a doctor in about another year, a real one. Not from this. I'm just in school to get a doctorate degree. So when y'all come back, well, y'all won't be coming back for this. I'll be Dr. Draper. So with Dr. Gupta, I can just stand up here with my chest stuck out too. But listen, but so our message is that of the vaccine gives us hope. It gives us hope. We don't know what the variants will do, but I think now, because one of the things was that if pastors did not have underlying conditions, we were not on the list as essential to get it. So it's hard to push what you have not received, and that's one of the things we shared with Chuck Schumer and the governor as well on different Zoom calls. I think I can venture out to say that most of us, all of those of us that had the shot, had COVID, and believe in locally what our leadership is doing. We're pushing it privately and publicly. Now we meet resistance, and there's a handful of us that really just, it is what it is. But for the most part, to answer your question, yes, man, we're actively pushing it to make sure that our community, because our community has been decimated by COVID across the United States of America, not just here, but all across the country. People of African American and racial ethnicity it affected us differently. And so we are, to answer your question, yes, ma'am. Yeah, I took the long way around.
This question's for anyone who'd like to answer. For members of the community who might think the vaccine is safe but might be facing peer pressure, I think that's what we might call it, from other people in their social circles who say it's not safe, what would be your message for them?
Every decision you have to make is personal. Every decision you make in your life is personal. Whether you go out at night or who you decide to hang out with, it's a personal decision. And so in relaying the information, get the facts. You will find the facts at the county website with the county staff. You will find the facts with the state health department. You will find the facts with the CDC. Get the facts and make a personal decision for your life. A personal decision. Understanding that your personal decision really is not personal, because your decision is affecting other people around you.
For those same people, should they be telling those other members of their social circles that they should be getting the vaccine? Should they be pushing that idea that the vaccine is safe?
If you have a circle of friends that are your friends and you care about them and you make a decision to go get the vaccine for yourself, then you should be sharing that information. I think part of it, I was in a conversation yesterday, and there's some other, we're always talking strategy about how to expand the knowledge and the access. And one thing that an individual said yesterday was that going to the state fair, all they could think of was the state fair, how we know the state fair. I don't want to go to the state fair with all those people. But when they got there, they could not believe just how streamlined it was. Just going in, driving in, going inside, and it didn't feel dangerous. The only way you can help an individual understand the process is if you go through it and then you're able to share your experience. I cannot yet, when my turn comes, I will, cannot speak to what the process, how it was for me to get the vaccination. I'm here today to tell you how it was to have COVID.
If you're comfortable, would you be willing to share a little bit more about your experience with COVID?
Yeah, I'm real comfortable. It almost killed me. One of the things was for us is adhering to the mandate that comes from government officials. And to really pinpoint where I got it from would be very vague, because I was still traveling. I was still doing funerals. I was still preaching. Now my churches were limited, so no people weren't here, but just in my interaction. And so it was a member of my church who literally saved my life. My church brought me a care package. They found out I had COVID. And they begged me, Pastor, stop moving around so much, stop moving around so much. But me, I'm young, contrary to what you may believe, I'm young. And as young, we feel like, we're invincible. And I was still running around, I'm still preaching, I'm still moving around. And so I ended up getting it, and I initially told my wife, I said, oh, ain't nothing but sinus. Anything that happens to me, the first thing I blame it on is sinus. It's just sinus. Now, granted, I'm watching the mayor have to quarantine, and I'm on the phone with my partner. I said, man, the mayor got to quit hanging around these people. Man, I'm serious. And we were laughing about Pastor Robinson. I thought he was going to be here. So we laughed, and we on the phone. I said, man, every time we turn around, man, the mayor in quarantine, man. I said, man, he around some bad people. And so I told my wife, I said, it's just sinus. It's just sinus. And I'm going to blow you away. This is crazy. Now, this is just precursor to what I'm saying. I laid in the bed with my wife, and she never got it. Yeah. So what ended up happening, I went to the hospital, and I went in an ambulance. And when I was sitting there, they were sitting there, and immediately they told me, yeah, he got COVID. Yeah. So I'm like, oh, y'all just self-diagnosing me. Okay. Got there. They told me, you got COVID. Cool. All right. They do the little test, the little breathing test. I'm an athlete, so even I can fake it like I'm all right. So I walked. I was all right for a minute. Then the doctor comes and he tell me, it's in your lungs. Got it, all right. They let me go home. They sent me home with Zithromat, Z-Pack, and a steroid. Okay, cool, I take it. My members find out I got it. They bring me a care package. Tyrone Backus brings me a care package. And normally I would come right out and get it. He sat outside my house for 45 minutes. And he said, Pastor, what you doing? I said, man, I'm upstairs in my house. I can't breathe. And I'm at the top of my house, and I live in one of the 5 sister homes. So I'm at the very top. And going up was a struggle, but now coming down was a struggle. So I got back to the hospital. On my way back, my wife, as she's getting ready to take me, she started collecting my stuff, and I thought she was putting me out the house. She got phone charged. I'm like, I ain't gonna need all this. I get there, and the COVID has spread in my lungs. And I get there, and I was at Krause. And I said my first Sunday back that I was just so grateful for the Krause team. So I'm in the hospital all these days, and here's the crazy part. The crazy part is you're in this clear room, and initially they didn't think I was gonna make it. They didn't think I was gonna make it. But to watch people pass from it, at this time it was at its height. They're putting them in the bag and they're rolling them out just to get somebody else in the room. And I can be honest, I was naive to it because you're saying, I won't get it. Everybody say that, I won't get it. I won't get it until you get it. And then when you get it, it's too late because you done got it. And so I finally get out of the hospital, and I'm thinking to myself, now I've been telling the members of my church, y'all stay safe, quarantine, social distance. I said, evidently I didn't do it. So I was down for a while. They wouldn't let me preach. It was eating me up. I was irritated. I'm depressed because I'm in another room in my house, my wife in another room, and you're suffering from isolation. You're insulated yet isolated. How do you not go take your shower in the shower that you love, but you got to go to the guest room shower, and the water pressure ain't as strong in there? I'm serious, and so it began to play with my mind so much so that I had made up my mind I wasn't coming back to church. I'm through. I said, Lord, I'm working for you and you allow me. He said, because you would not listen to the laws of the land. I'm serious. And so, and I was saying to them, so I finally came back and I preached. And I preached, and I was so short of wind. I call them the spiritual police. They look at me. They got me on a time limit. I never keep the time limit, and they be like, "That's enough. That's enough." And I just keep going and keep going. And the very first week I preached, it took me 5 days to recover. 5 days because of the fatigue. I went back to the gym. And they knew I had it. They knew I had it because, you interact with people. So they knew I had it. First of all, they can't really say what they want to say. They really want to say, you sure you ain't got it no more? But seriously, and so I get back in the gym, and the guy at the gym, he's just watching me because they can see it really affects your breathing, but most people don't understand this. It not only affects your body, it affects you mentally. Because I watched CNN, and all I could see was those numbers, and I knew I was a part, and I made up my mind I wasn't going to be a part of none of those numbers on CNN. And now I'm a part of this number, not realizing really I could have been a part of the other number. So it's like, and people, I tell people all the time, they want you to be, because you're a pastor, they want you to be super deep and super spiritual. It ain't no whole lot of depth to this. It's get the shot. For real, they say, and I know I'll have some people, but they know me. There'll be people who say, they'll come out on Facebook and all that and say whatever they're going to say, but they know I'm going to say something back. Y'all pray for me. They still working on me. I'm going, because here's the reality. It's dangerous. It's heartbreaking when your members cannot properly bury their loved ones because COVID restrictions. And not everyone died from COVID, but they didn't get a chance to say goodbye, or you got to go to the cemetery. So even me, so I started thinking, I said, man, I told Mr. Ferrone, he called me when I was in the hospital. He was like, I seen his name. I'm like, you the wrong person to be calling me. I don't need nobody who deal with dead people to be calling me while I'm in here. I'm alive. And so seriously, it affects you, and the lingering effects are from it. So we have to do something that I think I can say it this way. Preventive maintenance is better than prescriptive maintenance. If we can prevent it, I think our community will be better than trying to prescribe for it. Because once it got here, we're fighting behind the 8 ball. And we're trying to get from behind it. And now we've made some headway. So I think during this time, and I say this as a pastor, and I talked to Pastor Carter at Abundant Life, Pastor Jaime, this ain't about your church affiliation. It's not about your color. It's about getting our people in line so that we can embrace this new abnormal that's going to be normal. Now, please don't y'all ask me no more questions. I know my deacon over there. I don't know.
Anything left? Anything left? Any other questions?
Just one quick one for you.
Yeah.
The numbers, or how do you count a new American, say, who's from Africa? Would they be representing those numbers?
Correct. They would fall under African American.
And then
Okay. So part of the challenge too with the data collection, though, just to give you an idea. So if somebody declines, right, it's going to be under decline. In addition to that, unknown if they're refusing to answer, or they feel that they are multiple ethnicities, they don't want to identify as one. So the numbers are probably a little bit better when you look at non-Caucasian participation, but again, we really need to do better.
And do you have any sense of new American race versus population?
Yeah, so a lot of the new American rates fall under the Asian category. Specifically, we worked with a lot of elders in the Vietnamese community, Burmese community, and so Bhutanese. And each week, just like we're working with our credible messengers here today, we're working with credible messengers in those communities as well.